Welcome, dear. Come in. Yes, of course. Welcome to the Rad Clinic. So you're a new patient, correct? But you have heard of us. Well, in short, just to give a recap, we are a clinic that specializes in having patients who often either can't get a family doctor, can't get access to referrals, to come into us, do multiple testing, general exams, so that we can help you to get kind of pushed out to the different specialists that you need to get to. Of course, well, it is so difficult to get a referral. And a lot of times we have people who don't have an emergency but can't even get into their own doctor. So, of course. Did you have any questions for me? Anything before we get right into it? I want to try to not keep you as long as, possible. Okay, excellent. Then we're going to get right into here. I'm going to be taking a few quick notes on what your issues are. We'll be going through, I believe, 4 today. So if you'd explain to me the 4 different things that we're looking at. Okay. So you'd like to get your ears briefly checked out. Okay. You don't seem to have any hearing issues though. Okay. Yes, and you seem pretty young, so I don't believe you need to go to an audiologist unless, we deem that there's something that's an issue or something that you're worried about. Do you wear headphones, earbuds a lot? For work, okay. So we're more so just checking for impacted earwax, obstruction of the ear canal, etc. Okay, excellent. Okay. So that's your main worry? So if you're okay with it, is it me touching? It's right there? Excellent, okay. It's good to know, thank you. So we'll definitely check out your sense of touch there. And that particular, I believe it's the vestibular nerve we're going to go through. Alright. So you're having a weird sensation on your face, staticiness. How long has that been going on for? Okay. After. Pretty bad. I see, okay. Interesting. Okay, we'll definitely check that out. Probably get you referred to a nerve specialist. Okay, and we're on number 3. So you haven't had an eye exam in a couple of years? Yeah. It's generally recommended every 2-3 years to the average person, unless you're older or have some pre-existing issues. Okay. So we'll give it a quick check then in your eyes, but I definitely think I'll just refer you to an optometrist. Of course. And let's move on to number 4. Okay. So you're looking for a dermatologist. Sorry, I can speak today. Referral. I see here, yeah. For this breakout. Yeah, it seems very interestingly like just in this left lower location here. Yes, some white heads. So that's not normal for you? Okay. I'll definitely give it a look, but I definitely will then refer you. Okay. So we're probably looking at maybe 3 different referrals today. We'll see. Maybe 4 if there is an issue with your ears, but I'm not too concerned there. Well, if you're comfortable, my dear, and okay with me touching you and getting right into our first section of tests, okay? Yes, then we're going to get right into it here. Each one if I haven't said it already, we're going to be starting with a chart, okay? A lot of my patients like this part as this just gives them a better idea of what we're looking at, particularly when it comes to eye exams, ear exams, things like that. But I have here a cranial nerve chart, okay? This is a bottom-up view of the brain and all the different nerves that are connected. So there's 12 in total. We have the olfactory, we have the ocular motor in the yellow here, pink is the trochlear, abducens, vestibular in the bright pink, the hypoglossal, this web-like one here, the cranial accessory in this blue kind of rib-like look. We have the vagus, the glossopharyngeal, the fascial, the optic in the big green, here, and then the trigeminal here in the big blue. So today, for the purpose of your face and sensory, we're going to be focusing on the trigeminal nerves, okay? These ones are these big nerves that function as both motor nerves as well as nerves to do with sensory. So to do with touch on your face, sensation. That is kind of the nerve we're going to be focusing on testing today. Okay? Well, that is perfectly fine. Like, there's so many that we're just not going to worry about them. We're going to focus on your issue. But if you want it, I can definitely get you a referral to a craniologist who's going to go through and just give you a general cranial nerve exam to do with each of the 12 different nerves. Yeah, they're quite popular. People quite like them. Yeah, for sure. Well, did you have any more questions about this chart before we get right into checking out what's going on with you? Okay, excellent. Leave that there, but if you think of anything, please let me know. Alright, so if you're okay with it, I've got my gentle gloves on here. I'm just going to be touching your face, alright? Particularly here where you're having the nerve issue. Could you use some adjectives and words to describe what you're feeling to me? Okay, it's almost like when you fall asleep on your hand or your foot, and as it wakes up, it kind of gets all staticky, tingling feeling. Sorry. As a kid, I used to say my feet feel peppery. So if I were to touch this side of your face, it's not occurring there, huh? Okay. And how about your forehead? No. Chin? Nose? Ears? No. It's just here. Okay. Yes, it's very interesting. It could be triggered by an illness. You know, sometimes we forget how interconnected our bodies are, and where a general illness or something could happen and it cause everything else to go out of whack. Okay. Does it hurt at all when I'm touching it? No. If I press it a little harder, how about there? Just makes it more weird sensations. Okay. Well then, I'm going to move right along, dear. I want to do a sharp versus soft test. You familiar with this one? Okay. You could just close your eyes for me. I just want to get a sense of if anywhere in your face, but particularly this location, there is a lack of sensing happening between different types of touch. Okay. So, eyes closed. Okay. How about this one? Try again, for sure. It's okay. Again. That Okay. Now if I were to do the same thing on the other side of your face. Yes, soft. Sharp. Sharp, good. Soft. 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 A few more. Yes, sharp. 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 And sharp. Okay. So what I am sensing here, my dear, is that the rest of your face, you can tell the differences very quickly, instantaneously. But this area here where you're having that weird sensation, it's a lot more of a delay. Like you were able to kind of figure it out after a time, but it's not registering. Okay. How did it feel to you? I see. Okay. Well, then what I want to move on to next, dear, is just for you to keep your eyes closed, and I'm just going to be touching different parts of your face, and I want you to tell me where I'm touching your face, okay? This is just a check, again, that there's no nerve issues happening on other parts of your face, alright? So you can still feel the pressure, it's just the difference is the pressure. I see, yes. And then with your eyes closed, where am I touching? Center of the forehead, good. Your chin, excellent. Good. Bridge of the nose, excellent. How about ear? Left ear, good. How about there? Right ear, good. Okay. Now, has there been any other symptoms or anything you've been experiencing? Yeah. That's it. So, just what you told me at the beginning. Okay. So, I will definitely write you a referral then. I unfortunately am not sure what exactly is the cause for this. Definitely make sure when I get you that appointment with the nerve specialist that you talk about the illness that happened, things like that. Yes. Okay. Well, I'm writing that referral up for you right now. I'll get you in as soon as possible, okay? It's not causing you any distress. Yeah, just, okay. Feels strange, feels concerning. I understand. That is test number 1 done for you. Or exam, I guess I should say. We're going to move on to our second one. Let's do your face mapping and kind of skin exam. Alright. So I have here, you may have seen this before, a face map. Face map. This is kind of related to different ancient cultures that would often tie parts of the face and map it to kind of the different organs in the body. So you've got your heart, your colon here and here, got the liver, small intestine in the center of the forehead, the bladder on either side of your forehead. Your heart is actually located, since it's such an important organ, on either side of your temples here, as well as your nose, the very center of your face. You have the liver in the center of the forehead between the eyebrows here, your kidneys and your livers under the eyes. We have the stomach on either cheek here and here, the lungs on the mid cheek, the colon on kind of your smile line areas here and here. The spleen right under the nose above the upper lip, The upper lip is the stomach, the lower lip is the intestines, you have the kidney and the bladder again here on the chin. So that's kind of a very basic overview of each area on the map. I'm going to do a general exam of your skin, alright, but I'm going to focus on your lower chin here. Kind of a mix of where the kidney bladder is, up a little bit to where the colon is there, but mostly kind of this area. Alright. Did you have any more questions about the face map? Okay. Not a problem. Okay. So I'm just going to get right in with my hands here, okay? Feel free to close your eyes, look off behind me at the blank wall, whatever you prefer. Eye contact is not a fun thing to deal with here. But, okay. So, do you use any particular products on your face? Have you changed your product recently, particular in that part of your face? Okay. Well, that's good, yeah, and the sunscreen is very important for sure. Okay. Have you had a lot of stress in your life recently? Even in the past couple months that's still lingering? Okay. Yeah, I would find that very stressful too. It's a big deal. Right? And there's times where, you don't think you're stressed. You think you're pretty calm, you're not really in your body, you're not changing, like, your exercise habits, your eating habits, you seem fine, but really there could be something internal happening. Is it sore at all here? No, we didn't say that before. Okay. Do you get breakouts at all then, or depends? Okay. Yes, from what I'm seeing, this could be just stress induced, but it's hard to tell, right? Do you have any benzoyl peroxide products at home? That is what I would recommend starting. I will definitely get you that referral, alright? Yeah, because it seems like a decently strong breakout of whiteheads here. Definitely a little red, a little sore, but it doesn't seem to be super cystic. So I'd say start with like a low 2% benzoyl peroxide cream. Very thin, very gently, just in that area, once a day. See if you can either up the percentage to 3, 4, 5% at the highest, or see if you could up to where your body and your skin can handle twice a day, having morning and night a little bit of that cream. But I will still get you that referral for sure. I'm just saying that if you do try that cream in the next couple days to a week, whenever I can get the appointment in, it might already start to make a difference. And it's good to know, because if not, then it could point to a, deeper, more internal issue, right? We want to prevent it from becoming, cystic if it continues, of course. And obviously, there's the try to eliminate stress in your life, but it's kind of hard. I understand. Get that referral for you now. Of course. Okay. Did you want me to write any notes for the dermatologist here? Anything else we didn't talk about? For sure. Okay. No, that's fine. Any information is better than nothing here. Good. Well, we are going to get along to our final 2 exams here. I feel like I've kept you long enough already. Our second last one, we're going to focus on your ears, okay? I'm going to do a quick exam, quickly go over this chart, see if there's, anything going on. My assumption is if you're having no hearing issues, things like that, you might have a slight buildup of earwax, but it's going to be nothing too bad, of course. So we have the layout of the outer and internal ear here, okay? So internal ear to the outer. So we have the cartilage that connects the upper part of your ear to the side of your head. We have the helix, the upper top part of your ear. Very popular spot to get big piercings. You have the anti-helix kind of here in that second layer into your ear, second level. We have the pinna, the outer bit of the ear here. We have the concha, which is kind of the inner circle where your physical ear goes into. And you have the auditory mola. It's kind of the excess skin cartilage that's going on that kind of hangs from your ear, where a lot of people get ear piercings with their first piercing. Alright. And then I'll just show you here. We have the muscle, the red here. It's on the inner part of your skin here. We have the temporal bone that lines the muscle. Okay. Then we have the ear canal that goes in, connecting the outer ear in through the ear canal to your inner ear structures. Alright. So we have, sorry, I'm trying to read this and show this to you. We have the malleus here in the green. We have the tympanic membrane, or the eardrum, that we have to be very careful to protect due to it being easily damaged, as you could reach through your ear canal, items, not toothpicks, sorry. Exactly that one can get in and damage if pushed too far into your membrane. We have down here, this little structure, the incus. We have the stapes that connects to the incus and the malleus. Behind the tympanic membrane is the tympanic cavity. We have the eustachian tube, connects in as a nerve to the brain. We have the eustachian tube here. Then we have the semicircular canals that are weaving and winding here. Then we have the cochlea, kind of looks like a snail. And then we have the vestibular and the cochlear nerves. Vestibular, cochlear. Okay. So today, my dear, we're not going to be focusing in this basic exam on any of your inner ear. I will be able to see through and kind of quickly examine the ear canal and the tympanic membrane. The inner part of the ear we obviously can't see unless we do some scans and different things. So that is only what you would be getting viewed if there were some major issues going on. So I'm just going to be examining around the outer part of the ear and through the concha into the ear canal. Okay? not a problem. If you have any questions later on, please let me know. So I'm just going to get you to turn. We're going to examine one ear at a time. I'm going to need you to turn to the right. Thank you. If you're okay, I'm just going to touch your left ear here. Okay. No pain as I touch it. Good. I'm just going to use my little pointer here that's very gentle to pull back, examine your back ear. Looks very good. Put that back there. Sometimes people tend to get sores back there, or especially with like summer heat and things like that, or wearing hats or sunglasses, rubbing with moisture all the time can cause some some like rashes, things like that, tears of the skin. But you look pretty good. Examine your lower lobe here. Yeah, you had a piercing in here when you were younger. Okay. I can see that it's healed quite well, though. I don't see any issues with it. Can you still put an earring in it? Yeah, I have that too on both my ears. I don't wear earrings very much anymore, but I'm one of those lucky people where the holes never closed up, so. Alright, moving on to like your helix here. Good. Examining in your inner ear here. Good. Okay. I don't see any issues. There's a little bit of buildup. Sorry, I say that 5 times fast. A little bit of buildup of kind of just some dry, dead skin, but oh, don't feel bad about it. We all get it. Don't worry. It's so minor that it would be hard to even notice. Alright, now I'm going to get my little light and briefly look into your inner ear. Okay? Sorry if it's a bit bright. I'm going to see as best I can. Pull your ear back here. Good. Okay, yeah, that's not too bad. Yeah, no redness, no soreness. Do you get ear infections very often? No. Okay, yeah, your ear looks very healthy. A little bit of very typical amounts of earwax, but no blockage. I can very clearly see down your ear canal to your tympanic membrane. Good, good. All right. And to the left, please turn your head. Thank you. Moving on to your right ear. Okay. Good. Pull your ear forward, check the back. Yeah, not too concerned there. Put your ear back. No soreness again. Good. Pull your lobe down here. Good. Okay. Examine the helix. Inner parts of the ear. Cochlea. Yeah, there's not even any dry skin on this side, so not a problem. Okay. And we'll just move right along to your inner ear. Okay. Oh. Gotta turn my flashlight to the right side here. Pull it back. Good. Okay. Yeah, a little more earwax in here, but nothing that's beyond normal amounts. You can still clearly see through your ear canal to your tympanic membrane. Okay, no worries there. And you had no concerns with it. Excellent. No issues? Okay. Well, that is perfect then. Make a quick note that I don't see any reason for you to go to a ear specialist audiologist at this point, especially because of your age. I think it's very important that even if we don't have hearing issues, I recommend patients, 50 plus, 55, definitely once you hit 60, to get, an ear testing specialist to review your hearing every 3 years or so. Some patients like it so much that they go every year. But okay, so no concerns there. Good. That means we are free to move along to your last exam. All right. I've got here your eye chart. There is lots of information on here, so we will go through it fairly quickly. This is a lot of the inner eye structure that we will not be looking at today. I'm just doing a very basic exam of your eyes. I'm more so actually looking at here. I'm going to be examining your eyelid, your lacrimal canicle. So it's kind of like that weird little mushy thing on the inner corner of your eye. And this is where your tear ducts are here. So I'll be examining that as well, making sure there's no inflammation, things like that. You've got your pupil, your iris, the colored part of your eye, and the sclera, which is the white of your eye. Right? So this is the part I'm going to be examining. Doing a quick little test to make sure your eye movements are okay. Not too worried, as I've been watching your eyes this whole time and I'm not seeing a problem. But with this inner part of the eye, this is what happens when you go to an optometrist and you get the full scans, inner looks at the back of the eye. Yeah, all those fancy machines. So I'm going to examine this outer part of your eye, though if there's no issues, I probably am still going to refer you to an optometrist just to have this inner eye examined. If you said it's been a good few years. Generally, I believe it's recommended every 2-3 years to see the eye doctor if you're someone who's not older or doesn't have pre-existing issues or conditions to be watched. But that's kind of where it's important to have it checked to make sure that you don't have an inner eye developing issue that just does not cause physical outward symptoms. Would that be okay? Of course. Right. So, quickly in the inner eye here, I've got the scleras. This is the white of the eye, and then we're going to be looking way inward beyond what we can see with our own human eyes. We have the choroid here, the retina, we have the macula luata, we have the central depression or the fovea centralis. We have the optic nerve and retinal blood vessels connecting to your brain and everything, obviously. We have the medial rectus muscle for, I believe, eye movement and things. Again, this points between the sclera, the iris, the pupil. We have the cornea, which is the thin layer at the front here. The anterior chamber in light blue here, filled with aqueous humor. Posterior chamber. Posterior chamber is down there. We have this Serene ligaments, like a very minor muscle, almost. We have the ciliary body and muscle. I'm sorry, I missed the optic disc, which is like your blind spot. Okay. I know, it's so interesting, very detailed. But, so, did you have any questions about this chart here, my dear? Well, when you get that referral, you can definitely ask the optometrist any detailed questions that you may come up with at that point. So before I start shining a bright light in your eyes, I'm just going to examine your eyes, your tear ducts. So look straight ahead at me. Okay. Yep, I'm seeing no redness, no issues. It's okay, I'm going to pull down each of your lower lid. Okay, examine your tear ducts. Good. Let go, right one. Do you get allergies sometimes? Yes, this time of year, I know. A lot of people do. You just got a little bit of, what's the word? Like a wateriness, I guess, to your eye, specifically the right one. Yeah, just try not to rub them if you can't avoid it. It can make it worse for sure. Especially if you get any pollen or irritant on your hands. Okay, I'm gonna lift your upper eyelid here. Yes, I see a bit more wateriness there. But no other issues other than that. Left. Okay. Can you look just down for me as I lift? Okay. Yeah, it's definitely the wateriness is in the right here over the left, but there's still a tiny bit of wateriness in the left. But upon that inspection, I'm not too worried. We're going to finish off today with a bit of the light here, alright? So I'm just going to get you to follow the light when it comes into view, okay? Good, yeah, just looking straight at me. Excellent. Only move with your eyes. Good. Just making sure you've got okay eye motion. Good. Good. Excellent. Very good, my dear. What about back here? Yes, good. And look on my left shoulder here. Good. Okay. Now, I want you to look straight ahead at me. Don't look at the light. Gonna lift your eyelids just briefly again. Look straight ahead at me. Good. And your lower. Sorry if it's uncomfortable. Good. And again, keep looking at me. Good. And the lower. Pull that down. Yeah, sorry if it's bright. Keep looking ahead at me. Thank you. Okay. Good. Now, tell me how many fingers I'm holding up. Don't look at the light. Good. How many fingers do you see? Don't look at the light. Good. How many fingers? Don't look at the light. How many fingers? Don't look at the light. Good. Well, good news to be expected. I don't have any worry about your eyesight. Though if you would like, I would definitely recommend getting a referral for optometrist, just again because it's been, past the amount of time you should have seen someone. So this will probably be just beneficial for you to make sure you actually don't need eyeglasses. You don't need maybe reading glasses, things like that. Do you have a pair of sunglasses? Yeah. Well, I'd recommend, if you can, getting a good pair of polarized lenses. And wear them obviously a lot because they will definitely help your eye from sun damage. Yes, it's very important. I was reading up a lot on it recently, and we try to often, like you're using sunscreen and stuff like that to prevent your skin and protect it from the sun damage and UV rays, but we need to protect our eyes as well, even if we're not looking right at the sun or we're on a beach or something. Excellent. Well, I will do that now. So you have 3 referrals, and you're all good with your ears there. You don't have any concerns. Okay, so we won't worry about a referral for that right now. But I've got the other 3 there, and I think that is it, my dear. Any final questions, concerns before we get going? Well, thank you so much for being my patient today. I'm glad to have gone over all the charts, all the exams with you. You'll get an email from each of the different referrals in the next couple days to set up an appointment, give them a call, and get all these things, and hopefully, especially this kind of skin nerve sensitivity on your face, sorted out. Excellent. Well, you take care, my dear, and I will see you later. All right. Best of luck. Bye now.